Welcome back to Untold Physio Stories podcast. I'm your host, Dr. E, and my co-host
Dr. Sean
is
Wells, welcome.
how's it going
It's
today,
great.
Sean?
Beautiful day here in Florida. How about you?
Great. I think we heard waves crashing last time. Every time you spoke in the
Yeah, we
background.
had a big storm come through, and the seas got picked up to about 7 to 10 feet. And when that happens, it's just really loud here. It's really nice. Got some good surf the other day too. I think for a couple hours, my arms are pretty tired after that.
Oh, nice. Yeah, see, I don't surf, right? So I would have no idea that you would actually get tired doing that. But I guess is it kind of like sled riding where you do most of it actually not doing the
Correct.
thing?
Yeah, it's more work than play, but at the end of the day, you earn your keep, which is also really rewarding, and it can be taxing on the shoulders and even the cervical spine too. Having that neck and extension.
Oh yeah. Well, it's all I mean, you're moving your whole
Yeah,
body, right?
absolutely.
But it's your head is kind of stationary and your whole body is moving around it. Is that kind
Yeah,
of the
especially
thing?
when you're paddling.
Oh, I meant like the actual surfing, not the
Oh, when you're
paddling.
actually surfing, yeah, I mean your head does move a little bit, but it's a lot of hip mobility, spine mobility. Yeah, and you got to have the ankle and obviously a lot of coordination between upper body and lower body when you're transitioning from
Mhm.
stomach to standing. It's a lot.
Yeah, it sounds like a new niche for you. Actually, have you ever thought about only marketing toward that
I
population?
have. Fortunately or unfortunately, that population sometimes can be really hit or miss. I have worked with a couple pros on circuits. I've done some work with them as they've come through the area, and that's been fun. One PT or one patient of mine, he's surfing now, I think out in California. He's originally from New Smyrna. He had an MCL tear, and he came through. A friend of mine said, "Hey, come work with this guy. He knows what he's doing." I tried to patch him up and give him as much as I could. I only had a day. It's like, what do you do in a day for an MCL sprain, right? So
Right.
gave him some neuromuscular exercises, rest, and then try to connect him with a PT out in California who kind of continued the work. But yeah, actually, when I was at CSM, there is a physical therapist. She presented with a rock climber and another physio who I think did skiing, I believe. And they did this kind of special athletic populations lecture. It was really good. Unfortunately, I didn't get a chance to check it out, but I did look at their notes, and the surfing stuff on there was really cool. And she's developed her own book and things, which is really nice.
Yeah, yeah. The more niche you are, the more of a population, or the more business you kind of get, right? But that's not even what we're
No,
talking
it's
about
not.
today.
Sorry.
So, yeah, no problem. Little banter is good. So, uh, I was recently referred a patient. She fell in her driveway and she had acute low back pain. I didn't get a chance to see her for maybe a week and a half. By the time I saw her, it was just central and right-sided low back pain. In Western New York, actually, we've had so much snow and ice, and almost like this crazy amount of ice, because maybe we'll get, say, a foot of
Hmm.
snow, and then it will be 40 or 50 degrees, just enough for it to melt, and then it will drop down to 20 or 15 at night, so that everything melts, but not completely, and then you're essentially left with an ice skating rink
Oh
in your
man.
driveway. So there have been so many I mean, sometimes I get out of my car and there's just maybe a 10-degree incline, and I can't even walk up my driveway because it is literally trying to, they say, ice skate
Yeah.
uphill, right? It's really difficult. I mean, one of those weekends too, my daughter, just walking out to my wife's SUV, she fell and just slid underneath
Oh
the
my
SUV.
gosh.
Luckily, no one, it wasn't moving
Yeah.
or anything, but yeah, she just went underneath like as if she was a mechanic on one of those boards,
Yeah.
you know. So I thought this would be, a pretty relatively straightforward case. And it seemed like that point was a relatively straight case. She was very limited in extension and side glides. She got better with extensions slash side glides that completely abolished her pain. And then one of my favorite questions also to ask at the end of a history was, well, is there anything else medically or anything else that you think is not related that you want to tell me? And she said, yes, I have this pain in both of my legs. It's chronic. It's been going on for 2 or 3 years. It hasn't really been getting any
Hmm.
better. It's to the point where my legs are so sensitive. I have to continuously change footwear. I have to often take off my boots. And she's someone who really likes nicer shoes, nicer boots, and of course it's cold here, so she's wearing kind of tighter fitting, nice leather
Sure.
boots. But she has to change her boots very often. And the thing that the two things she said really worried me. One, I also get just random bruising.
Okay.
And she said when I try to stretch my calf, which I kind of checked neurodynamics and things like that because I thought it might be referred or
Sure.
radicular. She said, "Oh, when I do this, what I was like a seated sciatic neurodynamic tensioner," she said that feels like a vein pulling, like it's got a vein is going to
Oh,
pop out of my
wow.
leg. So between the bruising and the diffuse sensation and that vein feeling, what do you think? Like
Well,
what would come to mind for
sure.
you?
Well, I guess I would go back and do review systems and say, all right, what did I miss elsewhere? Something that comes to mind is maybe a connective tissue type disorder, like Marfan's or something like that. So I would maybe dive back into her family history a little bit and ask, like, any of your family members have any sort of connective tissue disorders, blood clotting issues, that sort of thing, particularly if she's bruising easily. And then from a dietary perspective, I might ask her a little bit about like what other supplements she might be taking, because like vitamin K supplementation, excessive omega 3s, particularly in combination with things like ibuprofen, can also promote easy bruising and bleeding. But I don't know how did you proceed?
I said I think you should see, you should see a
Okay,
specialist. So I was thinking it was more of a vascular
sure,
issue, especially because of the bruising and just it's just such diffuse pain. It wasn't along a dermatome. It wasn't affected at all by any kind of repeated motions. Plus, this was chronic and way before her acute low
sure,
back pain.
okay,
So she said, "Oh, I'm going to see an ortho," and I said, "Well, I think you should probably start with the
yeah,
vascular." But she's like, "Well, I have this point with this ortho," and luckily so I followed up with her 2 weeks later, and I said, "How you doing?" She said, "Well, my back pain is completely resolved. It was better in a couple of days with those resets you
good,
gave me, and my leg pain is also completely gone." And I said, "Wow, what happened?" And I just was not expecting
sure,
this at all. She said, "Well, that orthopedic apparently he's a really out of the
well,
box
good,
thinker." And he was just asking me all kinds of questions, and I thought I was actually asking her all kinds of questions
sure,
too, because I probably went on for about 45 minutes after the resets, we were talking about this, and I was just really trying to do a really thorough
sure,
history. And she said, "Well, he's a really out of the box thinker." And he said, "Well, how do you like to sit?" So apparently, she sits with her either on top of either leg. She has very hypermobile
okay.
hips. She can sit with say 90 degrees of hip external rotation, and she always sits on her calf
Ah,
all day
okay.
for hours. And she wasn't sitting like that at all during the entire hour that I
Yeah.
spent with her. So, and I thought I asked her, "Do you cross your legs when you
Hmm.
sit?" And she said no, because for her that's not crossing her legs, but literally she sits on
Oh
her
my
calf,
gosh.
either
Wow.
one.
Talk about a curveball.
And right, and then when she stopped that, now all her bruising and her pain is gone.
Wow. I guess it goes back to like look asking for those when those symptoms occur, like what were you doing leading up to that? That's really important, right? Other than just I was stretching my calf.
Well, it was always sitting. I feel it in
Okay.
sitting.
But how are you sitting? That's an
Yeah.
important
So
question, right?
right. Yes, yes. And I mean, for me, I just thought, oh, she's crossing her legs, it's cutting off her circulation.
Interesting.
But it was way worse. I mean, that's a long time. She said that, I mean, she sits that way in the car, she sits that way at work, and she has a
Oh
desk
wow.
job, and she sits that
Oh
way at
my
home.
gosh.
I mean, we're talking, how long are you awake? So how long could she possibly be sitting like
Wow.
that?
It goes back to I remember Rusty Smith. He was an ortho professor. He'd always tell patients when they say this is when it hurts. He would always say, show me how you're doing whatever that function
Mm-hmm.
is." That way, you could
Right.
really analyze the
Yes.
movement and see like maybe how there's an issue with what they're doing structurally or functionally.
Yeah. Yeah. I made an assumption about I mean, she was crossing her legs, but just not the way that someone calls it crossing
Sure.
their
I
legs.
mean that's reasonable though. Like I think a lot of providers make those assumptions, right? When we see patients that have been referred to us for primary care issues and things, they're like, "Yeah, my back hurts." "Well, when does it hurt?" "Well, when I bend over." "Yeah, sure, okay, go see PT." Like, well, there's different ways that people bend over, obviously, and that's like our job to go through all of those little nuances. But I have a feeling that even some specialists don't go that far. So good on that ortho for going into the details and
Yeah.
digging deeper. That's really cool.
Yeah, yeah, for sure. All right. Hey, so where can people find you, Sean?
You can find me online at Nutritional Physical Therapy or on your website, Modern Manual Therapy, but the Modern Nutritional Rehab. So you can find me there. You can also email me my practice,
Hmm.
wellsphysicaltherapy at gmail.com. And I have a Twitter handle, or sorry, X handle, Naples PT.
Right. And as you can see, Sean considers things that most PTs do not. He is quite the nutritional expert. And, I don't necessarily think of vitamin K unless now we're talking about cramps, which he just did a great review
Yeah,
on.
it's pretty nice to see how this supplement K2. So like for a while, K was always emphasized on blood clotting, a little bit on bone absorption, but then this randomized trial came out, and seeing it going from 3 intense cramps a week to one, that's pretty impressive because I know I have a lot of older adults that suffer from nocturnal cramps, and it's always like electrolytes, water, this, that, and it's always like nothing's hitting it, nothing is getting better other than just standing up, which does work, but when you're trying to sleep, standing up isn't very conducive to good
Hmm.
sleep. So it's promising. I'd love to see some more trials. There are some limitations, obviously, with the study. It is published out of China, so I don't know what kind of controls they have and what kind of rigor they have on the quality of supplements. And it is one RCT, so to really move the yardstick, I think we need a couple more just to see. But overall, K2 has a pretty good safety profile overall. It does have some blood clotting interactions and factors, but something that we need to kind of keep an eye on in the next couple of years for our patients that have nocturnal cramps.
For sure. Yeah, my son actually has severe, severe growing pains, and we honestly don't have the heart to tell him that it has nothing to do with growth,
Oh,
because, and I didn't realize how painful they were until he would just come and just be out of control crying. I mean, I just kind of thought that they were cramps, not that it was severe leg
hmm.
pain. Uh, and the only thing that really helped him actually was, oh gosh, it was some kind of it was a topical magnesium, I think. I don't know if it was magnesium or it wasn't potassium. Potassium, I was thinking, oh, maybe it's potassium after I read your article. But now that I'm trying to remember, I can't think of what it was. But I posted about it, and every time we use it, he's able to sleep. It almost goes away. I don't think it's placebo either because we've tried other things. We've just tried massage.
Sure.
Massage does not work. But I know I podcasted about it earlier, so I have to got to think about it. And it's just escaping me. But
Yeah,
but after I read that too, I'm thinking, oh, maybe it's potassium. Maybe it's
sure.
K2. Yeah. Although
There's
although you
a
said
lot
you
of
don't
a
even know the
lot of
dosage
ways.
for adults, I'm thinking like now I don't know, absolutely don't know the dosage for kids.
Oh, for K2 or
Yeah. Yeah.
yeah, this was 160 micrograms. That's what they did in the trial. So it's a fairly small amount. And I would love to see, what I need to do is dig further and see how much K2 you get from a normal dietary intake of, like, say, spinach, because that's a
Hmm.
lot, in my mind, probably more natural and better if you're just going to eat a big bowl of spinach before bed. Maybe not right before
Yeah.
bed, but like a dinner. Um, if that's just as effective as popping a pill, but yeah, overall, I think it opens up some other mechanistic pathways I have to dig further into understanding why K2 has those implications for nocturnal cramping and kind of what that pathophysiology is there. So it's
Yeah.
exciting.
Would you say because it's also harder to get a kid to eat these leafy greens?
Yeah.
So I've heard that if you blend them up, it's not as good, right? Is if you
Six in one, half a dozen in another. There is a little less of that insoluble fiber because the blades actually do chop some of it up. So yeah, you do get some degradation, but they are getting still a lot of those phytosterols and other good things that come with it. So I would say if you had a child who's not going to have the greens versus a child who is having greens in smoothies, for instance, I would definitely choose greens and smoothies over nothing at all.
over nothing? Yeah.
Uh, yeah, and then and definitely better than like a supplement because there's like AG1 and like there's been a lot of pills on the market where you encapsulate like that little bit of spinach in a pill. Like again, I kind of really question like quality control and like how nutrient dense it is and like let's say how much spinach can you get into a tiny gelatin capsule that your kid's going to take versus throwing a handful of spinach into a smoothie. Like that's definitely more, I think, more robust. And then lastly, trying to find something that works. Like for my son, he used to hate spinach, and now I let him try balsamic vinegar. when was that? About a year ago. And I put a little bit on his greens, and he was like, "That's the best thing ever. I will eat greens till the cows come home because
Hmm.
that balsamic vinegar has that little bit of sweetness to it."
Yeah.
And to him, it's that like kind of that bliss point of like it's bitter, but it's also kind of sweet and sort of acidic. Like so for him, that worked. And it's sometimes trial and error and finding those things for your kids and I'd say even your loved ones. My wife really doesn't like greens either, but when I make a salad and again with balsamic vinegar, it's like it's a win. So
Yeah, I do like the balsamic vinegar for sure.
yeah, yeah, a little olive oil goes a long way.
Yeah. All right. So, hey, if you like this episode, if you think the case is interesting, or if any similar cases, reach out to either one of us on social media. Please rate Untold Physio Stories 5 stars wherever you listen to podcasts, especially Spotify and Apple, as that helps our discoverability. And you guys have a great day.
Okay, bye bye.